Hello. First of all, welcome to SPF Dermatology. I am Doctor Veda. This is your first appointment with us, right? Okay. Yeah, I didn't think I'd seen you before. So we are a very small practice. I will be taking care of you through your entire appointment today. First of all, going over some information and then doing your exam. Okay. So just pulling up your patient portal to start. And can you confirm your date of birth for me? Okay. Thank you. And we have an address on file. Are you still on Main Street? Okay. Thank you. Yeah, I know you filled out a lot of this at home, so we're good. Can I get the best contact phone number for you? Thank you so much. And your email as well? Perfect. Okay. Your current marital status? Okay. Gender? We have that. Do you want me to add employment information? I don't have to. Okay, we'll skip that for now. And can I get a name of an emergency contact for you? You spell that last name for me? Okay. And what is this person's relationship to you? Okay. And a good phone number to reach them at? Oh, sure, yeah, go ahead. I know, I need my phone for everything. I don't think I would be able to call anybody if I didn't have my numbers in my phone. Okay. Thank you. And we got your insurance information up front. All right. So I'm just going to go through some health questions with you, and then we'll talk about why you're here today. Okay. What is your height? Okay. And your current weight, approximately? Okay. And do you have a primary care physician? Yes. Okay. Can I get their name? Okay. Yeah, I'm familiar with that practice. Okay. They're great. All right. And have you had any surgeries in the past? This would include any cosmetic procedures. Okay. And what was the date of that? Right. And anything else? Okay. Yeah. All right. Okay. And any adverse reactions to anesthesia or numbing agents? Okay, lovely. All right. Okay, now I'm going to ask about specific health conditions. Any arthritis? Okay. Asthma? Okay. Autoimmune disorders? Okay. Bleeding disorders? Okay. Cancer? Diabetes? Okay. Cold sores? Okay. Any gastrointestinal issues? Okay. Thyroid issues? Hepatitis? Heart disease? High blood pressure? High cholesterol? Okay. Are you on medication for that? Okay. Kidney problems? Lung problems? Any musculoskeletal problems? A history of stroke or other neurological issues? Any psychological or psychiatric conditions? Okay. Yeah, anxiety is very common. Are you taking any medications for that? Okay, we'll get into that after. Any history of skin cancer? And then any family history of skin cancer? Okay. Other skin issues such as dryness, acne, rosacea. Okay. Yeah. Put that down. Okay. Did you ever take Accutane? Okay. Your skin looks great now, so I think maybe that was just a teenage thing. Okay, that's great. Do you smoke? Cigarettes? Okay. Do you drink alcohol? Okay. How frequently? Okay. And how many drinks do you usually have whenever you drink? Okay. Thank you. Any recreational drug use? Okay. Any bleeding or bruising problems? Okay. Yeah, no, just the odd bruise here and there is totally normal. Any problems with excess scarring or keloids? Okay. Good. Asked about family history of skin cancer. Have you ever been told that you've had an atypical mole or something that needs to be looked at? Okay, yeah. And where's that? All right, we'll take a look, definitely. And we talked about medications a little bit already. Can you tell me the medications that you're currently taking? Okay. Is that daily? As needed. Okay. And what else? Okay. Do you know the dose on that? 20 milligrams. Anything else? Okay. Do you have any drug or latex allergies? Okay. All right. So now, what's bringing you in today? Okay, yeah, I can definitely. I'll look at especially that one mole you talked about, but have you ever had a full skin check? Okay, yeah, with your complexion and just questionable moles, I'd like to do a full skin check on you today, head to toe. Just gonna check your skin for any abnormalities, paying special attention to your moles and any potential signs of skin cancer. Okay, and if we do see any moles that look a little bit iffy, show any signs of possibly being precancerous or cancerous, I will basically remove them and we can test the cells for any abnormalities. If any are found, then we go back and excise a greater area of the tissue just to make sure that you are totally safe going forward. Yeah, okay. So that would be done under a local anesthetic. So I would go ahead and inject you with a numbing agent so you would not feel any of it at all. And the healing time is very minimal. You just have to wear a band-aid over it for a couple of days. We suggest applying Vaseline and a band-aid every day just so that it doesn't stick. And then you can change the bandage easily and not cause any further damage to your healing tissue. But the only pain you will feel is just a little pinch of the needle. I don't know if you ever had Novocaine before. Yeah, it's kind of like that. So it's sort of that pinch and a very slight sting as it's injected, then you're fully numb. Yeah, and we might not have to do that, but I just like to let you know up front so that you're fully prepared. Let's see. So we'll take a look at that. Any other skin issues that you would like to address? Okay, yeah. So pretty much we're just going to do the full skin check and take a look at those moles. Do you currently use a sunscreen? And how often do you use a sunscreen? Okay, so mostly just when, yeah, so when you're going to be out in the sun for longer periods of time, like at the beach or pool. Okay. Any daily SPF on your face? Okay. So for somebody with your complexion, especially in the summer, but really year round, I would recommend at least a moisturizer with an SPF for your face daily. But absolutely sunscreen when you're outside for prolonged periods of time. SPF 50 is great, so that's good. And then how often do you reapply when you're outside? Okay, yeah, that's good because we definitely suggest reapplication every couple of hours, and definitely after exposure to water or swimming, or if you're playing sports and sweating. Okay. And you did not have any interest in any cosmetic dermatology right now? Okay. No, definitely not that you need it. We always ask. Oh yeah, so we offer injections such as temporary fillers, Botox, Dysport. We do chemical peels, dermaplaning, glycolic acid treatments, laser hair removal, and IPL, microdermabrasion, retinol, all that stuff. Okay, yeah. Well, we can definitely look at that for the future for you if you're interested, but today we will just focus on your skin check and the moles. All right. So I have all of that. So now I'm just going to ask you to go ahead and there's a gown on the table for you, so you can put that on. Opening is in the back, and you can leave on your undergarments, but anything over, including socks, because I do have to look at your feet, all your skin. So just go ahead and you can put that on. I'm going to give you some privacy for a couple of minutes to get changed. Then you can take a seat on the table, and I will be back personally to do your skin exam. Okay? Yeah, it's pretty quick. It only takes a couple minutes, and then if we do have to do anything with your moles, yeah, let me just tell you. So I can get you, I'll get you a pamphlet for this, but what you're looking at, particularly in moles, your ABCDEs. So that is asymmetry in the mole. So if you're seeing asymmetry in a mole, that can be a warning sign. B would be border irregularity. So if the border around the outside of the mole is irregular, particularly if you have any sort of, if it looks like an island with jagged edges or fading edges, that can be a potential concern. Color variegation inside of the mole. So if you have a mole that's displaying different colors throughout, that can be a sign of concern. D is diameter, so anything greater than 6 millimeters. We definitely want to look at that. And then E is evolving. So anything that you've noticed changes in recently, such as size, shape, color, any possible bleeding or scabbing, definitely want to look at those. So you can do those checks at home as well. I'll send you the pamphlet, and if you see any of those warning signs in the future, definitely want to get you back in to look. We'll also want to probably do a skin check every year, but for now I will leave the room for a moment, let you put on the gown, and I'll be right back. Okay. Okay, so are you ready for your skin exam? Awesome. Okay, I'm just gonna put on some gloves before I get to looking at your skin. And we'll do a full head to toe So that's going to include me looking through your hair first and looking at your scalp. You can get moles on your scalp, of course, but it is a lot less likely for those to have issues just because your hair kind of protects your skin on your scalp from most sun exposure. So look there first, and we'll look at face and neck, everything else, okay? Perfect. I'm just gonna come in here. Okay, so I'm gonna start just by looking through your scalp, okay? Okay, we can look through here pretty quickly. Just pulling your hair. I'm gonna come around this side and get a look at the back as well. Okay. And the other side here. Look at the back as well. Alright. So your scalp looks good. That's good. Now I have this light and magnifier. It's going to help me get a closer look at your moles. So I'm going to be looking at your face and especially the mole on your ear. We definitely want to look at that. Okay, yeah. So the one on your forehead here, that one that looks totally fine. I don't see any warning signs there. But the one on your cheek here, so that one is a little bit abnormal. I'm very doubtful that it's going to come up with abnormal cells, but I'd like to remove that one just because it does have that sort of irregular border. So I want to take care of that. Let me just look at your ear here. Okay. Yeah, this ear is good. Going down into your neck. Other side. Yeah. I'm not loving that mole on your right ear. I think we'll take care of that as well. Just looking at your neck here. Okay, neck looks good. And coming around. Yep, good on the back. And good here. Put this down for a minute if I see anything else. Okay. Alright. I'm just going to open the gown and pull it out a little bit, okay? So we can see down your chest. Okay. Alright. Looking good there. Okay. And then looking at your shoulders. Yeah, everything looks good there. I know you have some moles, but they don't look suspicious at all to me. Come around and look at your back. Okay. Yeah, all good there. Now I'm gonna pull up the gown a little bit, okay, so I can look at your stomach area. Okay. Okay. Just look in here. Yeah, that was fine. No issues there. Oh, legs look good. Come all the way down here. No, I'm actually gonna look between your toes, okay? Alright. Good. Very thorough. Okay. Excellent. Just take a look at your arms. Yep. Okay. Yeah, that one, you have that one on your arm, on your forearm. The color of that is a little darker than I would like a mole to be, so we're going to take care of that one as well. So we have your left cheek, your right ear, and then the left forearm. So we'll be taking care of all of those, but everything else looks absolutely fine, okay? Again, painless. Just go ahead and get my materials ready over here. Already have everything laid out. Okay. So, first thing is I'm going to sterilize, of course. So, come in here and your face first. Okay, and then your ear. Pull your hair back and sterilize that ear and your arm here. Okay, lovely. Suppose I can turn that light off and conserve the battery. All right. Now it's just a very tiny needle. We're gonna go ahead and do a quick injection in each of the moles themselves, so you will not feel anything. Okay. Okay. I'll give you a second. I totally understand a lot of people have a fear of needles. I myself, I don't like them either, really, when they're coming at me. But I promise you, very, very little pain at all. Just a pinch and a sting. That's it. And it's a tiny needle, alright? Okay. Yeah, let's do your arm first, okay? So you don't have to look at it at all. Just pull that out, okay? Alright. Just come over here. And would you like me to tell you when? Okay, I'll just get ready here. Okay, no worries at all. Just don't move and you are so fine, okay? Okay, and 1, 2. Okay, you're gonna feel a pinch now. Okay, there we go. Good. Get that in there. Okay, there we go. That is all you're going to feel for that one, okay? And now I'm just gonna come up and we'll do the one on your ear and your face, all right? So just nice deep breaths, nothing at all to worry about, okay? Now, are you ready for the next? Okay. Just gonna come up here to your face. All right. So I'll tell you when, okay? You can close your eyes if you'd like. That would help. All right, ready? And you're gonna feel a little pinch and 1, 2, little pinch now. Okay, here we go. Yeah, almost done there. Just getting that in. Okay, beautiful. Okay, so 2 down, 1 more to go. Okay, just give you a minute to recoup and get ready for the next one. Okay, all right. So just come in here to your ear. All right, and I'm just gonna hold that. So actually, mostly for this one, you're just gonna feel my fingers, because I'm gonna have to kind of hold that taut. So pinching with my fingers now, and you're gonna feel the little pinch of the needle, and 1, 2, okay, little pinch. There we go. Okay, perfect. All right. You did awesome, and I promise that's all you're going to feel, okay? Alright, so we'll just give that a second to kick in. Should be very numb. It works really fast, so that should already be pretty much done. And now we are going to get those going. Files are ready. Okay. So now it's sort of going to be like a scraping. You will not feel any of it at all. We're just going to remove that mole itself and send the tissue to be tested for any abnormal cells, okay? I'm going to start with your arm, okay? Alright. Oh yeah, you definitely don't have to look if you're a little bit squeamish. Totally understand. Okay, here we go. First of all, I'm just gonna touch it, alright? You feel that? Okay, a little harder, just rubbing. No, okay. So now I'm just going to do a quick little brushing scrape, not cutting anything yet. Can you feel this? Okay, perfect. Alright, here we go. There. You're doing awesome. Alright. Okay. There we go. Alright. Just go ahead and get that in a file. Meanwhile, just dab that. Okay. Good. Yeah, there's really almost no blood or anything. We just have you put the band-aids on really to keep it nice and clean and sterile. And then Vaseline first so that the band-aid doesn't stick. Alright. So, not so bad, huh? Okay. Yeah, I know it's still a little maybe kind of gross if you're squeamish, but you're doing great. I'm going to do the one on your face first, and absolutely nothing to worry about with this. It's not going to leave like a big scar or anything. There'll be for a little while it heals. You have obviously a small wound there. You have to wear a little band-aid, but it's not going to leave a big giant scar. It's going to be a little bit lighter or pink as it heals where the mole was. Okay. Yeah. Alright, so come in here. Fresh and clean scalpel. Okay. So I'm going to come up here and we're just going to start the scraping again. Ready? Okay. Okay. You're doing a great job. And don't worry, it's not going deep or anything. It just takes a little bit of time because I want to take layers off at a time. Not too deep. Yeah. Okay, perfect. Alright. Get that sample in the file over here. And cap that off. Okay, so that's 2 down. Let me just go ahead and come in, clean that up just a little bit. Okay. And then last one, I'm gonna go ahead and do your ear, okay? Alright. So I'm gonna just come in here again one more time, and I'm just gonna bend your ear a little bit so I can see where exactly I am doing a little bit of scraping. And get in there. Good. Okay. You're doing a great job. It sounds pretty scary, but the whole process is quick and it's hopefully not as bad as you thought it might be. Okay, get that. And clean that up. Good. Alright. We'll get you some band-aids, huh? Okay. Your arm here. And okay, we'll just come up to your face. Alright. And just your ear. You need a little one for your ear. Coming up here. Alright, this one's a little bit harder to get to fit the contour of your ear, so just make sure you're using a small band-aid, like a little round one would be perfect. Okay, excellent. Alright. So we're going to go ahead and send those cell samples to the lab in about 10 days time. We'll have the results back, and if there are abnormal cells, we'll have you come back in and we'll probably take a little bit larger of an area of tissue just to make sure we remove all of the abnormal cells so they don't cause you any problems in the future. In terms of the moles that you've had removed today, as I said before, really all you need to do is once a day, or maybe twice if you're working out or something, just keep them clean. You'll remove the band-aid, and you can use Vaseline on a new band-aid and place that over the wound. So you'll want to do that for probably about 3 days until those look like they're starting to heal up pretty well, and then you can discontinue wearing the band-aids. Okay? Yeah, and really you shouldn't feel any pain at all. The only thing you might feel a little bit of discomfort with is where we did your right ear. If you sleep on your right side, that might not be comfortable right now. It's not going to cause any damage, but probably won't be comfortable to do right now, just putting pressure directly on that. So other than that, all good. Do you have any questions for me? Yeah, so I have up at the front, when you go ahead and check out, I've given them the pamphlet to give to you, as well as the aftercare instructions for the moles that we've removed. Yeah, okay, so you can do a self-check on any moles. If you do see any changes, definitely come back here and see me. Other than that, I do want to see you back in a year for another skin check, just because our skin is always changing, evolving, you know, that sun exposure stuff. So we definitely want to keep an eye on your moles and your skin to make sure that you not have any issues in the future. Okay? Perfect. So I'll go ahead and leave the room. I will allow you to change back into your clothes and everything. And then once you're ready, you can go ahead and come out to the desk, and the lovely ladies there will get you all checked out. Okay? Perfect. Well, it was really, really nice meeting you. And if there's no issues at all, I will see you back in a year. Otherwise, we will be in contact about the test results. Okay? Awesome. See you soon. Bye.